So we have a 52-year-old woman with a 6-month history of rapidly progressive diffuse cutaneous systemic sclerosis is admitted to ICU with malignant hypertension. Whenever a patient of systemic sclerosis have a malignant hypertension, you have to think of SRC, that is scleroderma, that is systemic sclerosis related renal crisis. And patient is also having acute pulmonary edema because blood pressure is very high. Oligouric renal failure, creatinine is 4.2 mg per dl from baseline of 0.8 mg per dl 2 weeks prior. Headache and blurred vision because of hypertension. Over 48 hours, she developed worsened microangiopathic hemolytic anemia, schistocytol smear, LDH of 1200 and platelet of 85,000. So remember, systemic sclerosis, scleroderma can cause microangiopathic hemolytic anemia as a complication, and creatine rises to 6.8. Despite aggressive antihypertensive management and hemodialysis, she remains critically ill. On day 3, a rheumatology consultation is obtained. So they are asking what is the best that can be done. So please understand that in scleroderma renal crisis, what happened that in if we have this if this is the renal stenosed artery, it becomes stenosed. Why it becomes stenosed? Because of the vascular injury and intimal proliferation, and there is very hyper secretion of renin because renin angiotensin aldosterone system is hyperactivated. So this is state of very large renin in the blood. So what is the drug of choice for this? Drug of choice is always captopril. And please remember, this scleroderma renal crisis can be caused because of the steroid. Therefore in scleroderma, steroid is always prevented. What are the drugs that you cannot give? Beta blocker. Beta blocker should not be given. Lasix should not be given until and unless there is furosemide, there is pulmonary edema. Also, you should not use drug like sodium nitroprusside. So because sodium nitroprusside can cause cyanide toxicity and can cause renal failure. So these drug has to be avoided, and drug of choice is captopril. So what is the symptom that you will see? Symptom you will see hypertension, very malignant hypertension. Blood pressure will be in the range of systolic will be in the range of 180, 190, because of which there will be blurred vision, headache. There will be also oligouric renal failure, so that may require renal dialysis. Patient can have a severe abdomen pain. Okay, so these things will be present, and the drug of choice will always be captopril, and it can lead to a complication of microangiopathic hemolytic anemia. What is microangiopathic hemolytic anemia? Whenever you have anemia and thrombocytopenia, you have to think of the microangiopathic hemolytic anemia. And other investigations which are positive in these cases are increased reticulocytes, decreased haptoglobin,